Well, joining us for today's house call is Gundersen Lutheran fertility expert Dr. Kathy Trumbull, and she's here to talk to us today about Polycystic Ovarian Syndrome, also known as PCOS. So give us an idea, how would you know if you even have this?
Well, some of the main signs that a woman might see is that her periods are not regular, and so her menstrual cycles seem to be off track. Also, we find it when women are having problems conceiving, so they are having problems with infertility. They're like, I don't know why I'm not getting pregnant. And then sometimes women will notice that they're having abnormal hair growth someplace, like, you know, why am I growing a mustache, something like that.
All right, now what are other something like you talked about, you know, hair not being where it should be and things. What are some of the other risks that are really serious to your health?
Well, see, some of the things that you can't see are the risk for a higher blood pressure, things like diabetes. These women are at higher risk of diabetes. That doesn't mean that they'll have it in their 20s, but they could have it by the time they're getting older, because none of these risks really go away. They can have cholesterol problems. So it's just important that they're getting good medical care all the time, not just while they're trying to get pregnant.
Now, is this something you should ask about, though, at a regular checkup?
You can, but the physician might not feel comfortable trying to make the diagnosis because it's not that simple. And so that's why Gundersen Lutheran actually decided to start a special clinic for anybody who thinks they might have PCO. It is actually run through the fertility center. So you contact the fertility center and we set you up through there. And we have made special connections with people who can help with diet and exercise, because those are some of the main treatments to start with. And then sometimes medications would be appropriate, and then we worry about that. It's a disease that is something that's probably genetic. And so it's not something someone brings on themselves. So if they're overweight, if they have you know, the abnormal hair growth or something, they shouldn't feel bad about seeking help. It's not something they did to themselves. And that's where we try and help them, because they can feel pretty miserable.
I'm trying to figure that out. All right, Dr. Kathy Trumbull, thanks so much for being with us today and explaining PCO. All right, well, stay with us. Back in just a moment to wrap things up.